Okay, picture this. You walk into your parents' room, maybe your spouse's, and there they are again, the blood pressure pills, just sitting on the nightstand. You give a gentle reminder, and you get that same answer back. Oh, I feel fine. Besides, those pills just make me dizzy.
It's a really frustrating dance, isn't it? So many of us know it.
It really is. And it's more than just frustrating. It's actually a critical health issue. We're talking about medication non-compliance, especially with older folks managing high blood pressure, hypertension.
Right.
And the numbers are, frankly, alarming. It can reach up to 50%, half of patients.
Yeah.
And this lack of adherence often becomes the #1 reason treatment fails, not the drug itself.
Wow, 50%. That's huge. That feels pretty bleak. But there's hope here, right? That's what we're digging into.
Absolutely. There's real hope. Our sources, and we're drawing a lot from the work of Miss Lisa. She's a traditional medicine practitioner with like 20 years of amazing experience in this area.
Her whole approach is very family-centered. And what she's found, what the data shows, is that with the right kind of family involvement, you can see compliance rates jump, like up to 85%.
85%?
No.
That's a massive difference. That changes everything.
It really does. So this deep dive today, it's all about unpacking those strategies, the ones Miss Lisa and others have proven work. And it's not just about, nagging someone to take a pill.
No, it sounds much deeper.
It is. It's about transforming someone who's resistant into a partner in their own health. Because the core insight here, the thing we really need to grasp, is that it's usually not just stubbornness driving this.
Okay, so if it's not stubbornness, what is it? What's really going on?
Often it's things like fear or confusion. Sometimes it's this profound feeling of losing control, of powerlessness.
Ah, I see.
And that means for you, listening right now, if you're that family member, that caregiver, understanding and addressing those underlying things with consistent support, that's how you change the game.
So your role is really central.
It's pivotal. Your involvement has this incredible impact.
Okay, let's really get into that then. Your crucial role in making treatment actually work. Why is family involvement so dramatic?
Well, there's some pretty compelling research, like from the National Center for Biotechnology Information. And it points to something kind of amazing.
Yeah.
Family caregiver support. It's the strongest predictor of whether an elderly patient with hypertension will stick to their meds. Stronger even than the patient's own beliefs about their health.
Stronger than their own health beliefs. Wow.
Yeah. It tells us family support isn't just, a nice to have. It's fundamental, absolutely foundational.
That really puts it in perspective. So it's clearly way beyond just reminding them, hey, did you take your pills?
Oh, much, much more. Think about it. Your loved one isn't just fighting high blood pressure on a physical level. They're grappling with this whole complex web of psychological stuff, too. Physical challenges, yes, but also emotional ones.
Like what?
Well, every single pill can feel like a constant, daily reminder. A reminder of getting older, of maybe becoming dependent, of their identity changing in ways they didn't choose.
I never really thought of it that way.
And that's exactly why the sort of simple, direct approach, just take your medicine, why it so often just falls flat. It completely misses the human side of the equation.
That reframes the whole challenge, doesn't it? Okay, so if that's the case, what does good family involvement actually look like? Our sources talk about 3 key pillars, right?
That's right. 3 pillars for family-centered care. Pillar 1 is about building what we can call an emotional security architecture.
Okay, emotional security architecture. Sounds important.
It is. Your role here isn't to be the medication police checking up on them. It's to be their emotional anchor. Think about that, an anchor.
An anchor.
And studies back this up. Elderly patients who feel strong emotional support from their family, they have 60% better medication adherence rates.
60%.
Yeah. Take the example of Mrs. Chen's daughter. Her mom's compliance was down around 30%, really low. The daughter shifted her approach, started by really validating her mom's worries and frustrations, and then gently reinforcing why the treatment mattered. In just 3 months, her mom's compliance jumped to 90%.
Wow. That's incredible, just from changing the emotional approach.
Exactly. Empathy first. So an emotional anchor, not medical police. That's pillar 1.
Got it. Pillar 2.
Pillar 2 is about practical management systems. The idea is to create these invisible support structures, as Miss Lisa called them.
Invisible support structures? Like what?
Systematic ways to organize the medication that make it easier for them, reduce the mental load, but without making them feel like a child, infantilizing them.
Right, that's a fine line.
It is. But simple things like using pre-sorted pill organizers, that alone can boost compliance by 70%. The absolute key here is helpful involvement, not controlling micromanagement.
Support that doesn't feel like you're taking over their life. Makes sense. And the third pillar, connecting with the doctors.
Precisely. Pillar 3, communication bridges with healthcare providers. You become this vital link.
Yeah.
Think about doctor's appointments. They're often short.
Yeah, too short sometimes.
Right. And patients, especially older ones, might downplay symptoms or they might forget key details. Your observations from day-to-day life provide crucial context that the doctor might otherwise miss. You bridge that gap between home reality and the clinic visit.
That makes so much sense. You see things they might not even realize are important, or maybe they forget to mention.
Exactly. That context is invaluable.
Okay, so we have these pillars: emotional support, practical systems, and communication bridges. But even with all that resistance, it can still be a huge roadblock. What's going on psychologically?
Understand the psychology is key to responding collectively. There are common barriers.
Yeah.
One big one is a feeling of loss of autonomy. Taking pills every day just reinforces that feeling of dependence.
I could see that.
Then there are side effect fears. Maybe they had a bad experience before or they've heard stories. These fears can be very real to them. Sometimes it's cognitive decline. Genuine confusion about which pill to take when, or did they already take it. It's not willful defiance.
Right.
And don't forget financial stress. Worrying about the cost of medications is a huge burden for many seniors. Or even social stigma, feeling embarrassed about having a chronic condition.
That's a lot to deal with on top of just managing the illness itself.
It really is. Which is why your strategic response is so important. Remember Mr. Rodriguez, the 78-year-old whose pills made him feel weak.
Yeah, you mentioned him.
His son didn't argue or lecture. He listened. He said, "Okay, I hear you're feeling weak." He validated it. Then he worked with the doctor to adjust the timing. And the result?
Perfect compliance for months.
8 months.
Yeah.
Perfect compliance.
Right.
That shows the power of understanding the specific concern over just arguing about the necessity of the pills.
Listening and validating first.
That's the foundation. And building trust comes from that consistent, non-judgmental support, day in, day out. When you show up as an ally, not an authority figure barking orders, the whole dynamic shifts.
It sounds like it takes real patience, though. It's not a quick fix.
Oh, absolutely not. It's definitely a long game. It requires patience, flexibility, and just genuine respect for their dignity. The goal isn't to control them, it's to empower them to manage their health effectively.
Okay, so we've covered the why family matters, the psychology behind resistance. Now let's get really practical. How do you actually do this? Mastering that gentle encouragement, the smart reminders.
Right, because how you communicate and when, that's often the game changer. It can completely transform resistance.
So what's the approach?
We call it the partnership approach. And the data here is striking. Research shows patients respond something like 400% better to collaborative language compared to commands.
400%?
Yeah. It's the difference between you need to take your pills now and, hey, how can we make managing your blood pressure easier for you today?
Totally different feel. Collaborative versus directive. So how do we actually use this partnership approach? What are the steps?
Okay, 5 key steps. Step 1, empathy. Always start there. Validate their feelings. I can see you seem really frustrated with these medications right now.
Yeah.
It builds connection immediately.
Okay, start with empathy, then what?
Step 2, the curiosity approach. Ask open-ended questions. Not, did you take your pill? But, what's the hardest part about taking these medications for you? Invite them to share. It opens the door for problem solving together.
Instead of making assumptions, you ask. Got it.
Then, step 3, the education partnership. You're sharing information, but as a team member, not like a teacher lecturing them.
How would that sound?
Maybe something like, I was reading something interesting about how this type of medication works, and it made me wonder if timing could make a difference for us. See, it's us. We're learning together.
Okay, partnership. And step 4.
The choice framework. Offer meaningful options whenever possible. It helps them feel like they still have some control. Would you prefer to take your morning pills with breakfast, or maybe right after you brush your teeth? Simple choices matter.
Giving back some sense of agency. Love that. And the final step.
Step 5, the celebration ritual. This was huge and often missed. Acknowledge every single success, no matter how small it seems. Hey, I noticed you've been really consistent with your meds this week. That's fantastic. That's making such a difference. Positive reinforcement works wonders for motivation.
Empathy, curiosity, education partnership, choice, celebration. Those 5 steps seem really powerful for conversations. But what about the practical side, the actual reminders when memory is an issue?
Right, we need reminder systems that actually work and don't just add stress. One great method is the invisible integration method.
Invisible integration?
Yeah, link taking medication to a habit that's already rock solid. If your dad never misses his morning coffee, put the pills right next to the coffee maker. It just becomes part of that existing routine.
Oh, that's clever. Seamless. What about technology? Lots of seniors are using smartphones now, but maybe not complex apps.
Exactly. Use technology that serves, not overwhelms. Simple alarms on a smartphone are often best. You can set gentle tones, or even better, record a short, loving voice memo reminder yourself.
Oh, like a personal message.
Yeah. Good morning, Dad. Time for your heart health routine. Love you. It keeps that human, caring connection, even through technology.
That's much nicer than a generic beep. What about visual reminders?
Absolutely key. The visual cue system. This means strategically placing medications where they'll be seen easily. And those weekly pill organizers. They're not just for sorting, they become visual progress trackers. Seeing the compartments empty gives a little sense of accomplishment each day.
Right, a visual done signal. And you mentioned pairing it with something enjoyable.
Yes. The buddy system revolution, I like to call it. Pair medication time with something pleasant. That family who created coffee and pills time. It turned a medical task into a nice morning chat. Quality time.
Turning a chore into connection. These are fantastic practical tips. But what if forgetfulness is like a really persistent problem? Are there more advanced strategies?
There are. For persistent forgetfulness, consider the double check method. A small whiteboard right near the meds where they can physically check off the dose they just took. It provides visual confirmation and reduces that anxiety of, did I or didn't I?
Good one. Like a little checklist.
Another powerful one is to connect to values. Instead of just talking about abstract risks like stroke, link the treatment to what they actually cherish in life.
Bro.
Mom, taking these helps make sure you have the energy to keep enjoying your gardening. Or, Dad, this helps keep you strong so you can play with the grandkids. Make it concrete and personal to their life.
That makes it much more meaningful than just, it's good for you. What if resistance is still really high despite trying these things?
Sometimes you need a compromise strategy,
Yeah.
especially with someone very resistant. Instead of an ongoing battle, try negotiating.
Negotiating. Like what?
Okay, I hear that you're really struggling with this. Would you be willing to try taking it consistently just for 2 weeks? Then we can sit down and talk honestly about how you're feeling. Gives them an endpoint, some control.
A trial period almost.
Exactly. And finally, think about creating positive associations. Can you make medication time feel less like a burden and more like a little self-care ritual? Maybe play their favorite music then. Use a special teacup. Get a really beautiful pill organizer. Small things can shift the feeling around it.
These are all great tools for encouraging cooperation, but what happens when it's not just forgetfulness or mild reluctance? What about when you face outright refusal, that stubborn resistance?
Yeah, that's a tough one. And this is where a really critical mindset shift comes in. Non-cooperation, that outright refusal. It's usually not just about being difficult.
What is it then?
Often, it's a kind of desperate attempt to hold on to control. In a life where maybe they feel like they're losing control in other areas, their health, their independence. If you can see resistance as information about what they're feeling or fearing rather than just an obstacle, that changes how you respond.
Resistance as information. Okay, so are there different types of resistance we might see?
Definitely. Our sources point to 4 common types. Type 1 is fear-based resistance. This is these pills make me feel awful, or I'm scared of the side effects scenario.
Right.
The solution there is to take those fears seriously. Document the side effects they mentioned, talk with them to their doctor, explore if there are alternatives or adjustments, address the fear directly.
Okay, what's type 2?
Type 2 is autonomy resistance. This is the don't tell me what to do reaction. It's all about dignity and independence. The best approach here is to step back from telling and start asking. Offer choices. Let them lead the conversation about how they want to manage things, even small things. Empower them.
Give them back the reins where possible.
Exactly. Which is different from type 3, cognitive resistance. This isn't about defiance. It's genuine forgetting or misunderstanding due to cognitive changes.
Okay.
Here you need practical solutions. Maybe working with a doctor to simplify the medication schedule. Clearer, simpler explanations. Using those memory aids we talked about.
Yeah.
Practical support.
And the last type, type 4.
Type 4 is existential resistance. This can sound like, what's the point anyway? Or a general sense of hopelessness. It often reflects underlying depression or feeling overwhelmed by life or illness.
Ah, that's much deeper.
It is. And it means you need to address their emotional well-being, their mental state, right alongside the medication issue. Sometimes professional counseling is needed here.
So understanding the type of resistance really helps tailor the response. That's huge. What if things really escalate, though? Like, in the moment, it's becoming a confrontation. Is there a crisis protocol?
Yes, absolutely. Sometimes the smartest move when things get heated is a strategic retreat.
Strategic retreat, pulling back.
Yeah, just saying something calm like, okay, I can see this is really upsetting you right now. Let's take a break from talking about the medications for today. It stops things from spiraling. Often they might bring it up later themselves when things are calmer.
Create space instead of pushing harder. That takes discipline, I bet.
It does. Another tactic is the healthcare provider alliance. Bring in the doctor or the pharmacist as a sort of neutral third party. Patients are often more willing to listen to guidance from a professional than from family, especially if things are tense.
The voice of authority, but not your authority.
Exactly. And also, try the consequences education approach, but focus on the positive. Instead of threats like, if you don't take this, you'll have a stroke, share positive stories. You know, Mrs. Smith down the street felt so much better once her blood pressure was managed. Make the benefits of sticking with it feel real and attainable.
Focus on the potential gains, not just the losses.
Okay.
And if emotions are really flaring, anger, frustration, any specific de-escalation techniques?
Definitely. The emotional acknowledgement strategy is key. Before you try to reason, just acknowledge the feeling. Wow, you seem really angry about this right now, don't you? And then just be quiet for a moment. Let them vent.
Validate the emotion first.
Always. You can't have a rational discussion until the emotion is acknowledged. If things are really heated, use the timeout technique. You know what? Let's both take some time to cool down and we can talk about this again later. Explicitly call for a break.
Okay.
And sometimes, believe it or not, a little bit of reverse psychology can work. Not manipulation, but genuinely expressing your feelings. I'm just so worried about you, and honestly, I don't know how best to help right now. Sometimes that vulnerability can open their heart a bit.
Showing your own struggle. Interesting. These are great for navigating tough moments. How do we use this to build better cooperation over the long haul?
It comes down to trust. Think of it like the trust deposit system. Every interaction is either a deposit or withdrawal. Listening, validating, respecting their choices, those are deposits. Lecturing, arguing, nagging, those are withdrawals. You need to keep that trust account balance high.
Build up the goodwill.
Exactly.
Yep.
Also, use the gradual influence method. Start small. Maybe the easiest first step is just helping them organize their pills in the box. Get a yes on something, easy to build momentum towards bigger cooperation.
Little wins build confidence.
Right. And sometimes a family meeting approach can be helpful. Involving other family members respectfully can show the person that it's not just you who's concerned, and it helps them not feel singled out or ganged up on.
Shows a united front of caring. These all sound like they're strengthening the relationship itself, not just focusing on the pills. But there has to be a point where maybe you've tried everything and professional help is the next step.
Absolutely. You need to recognize those signs, like consistent refusal even when they clearly understand the risks. Or if you see signs of persistent depression related to their health, significant cognitive changes that are really impairing their judgment.
Okay.
Or, honestly, if the conflict around their health is severely damaging your family relationships, that's a sign too. In these cases, it's really important to document specific incidents or concerns and bring them to their doctor.
Right, time to bring in more formal support. That's such an important boundary. And speaking of boundaries, what about protecting yourself, your own emotional health? This sounds incredibly draining.
Oh, it absolutely can be. And this is vital. You have to remember, you cannot ultimately control another person's choices, even if those choices impact their health, and even if you love them dearly.
That's hard to accept sometimes.
It is. Your responsibility is to offer love, support, information, and help create the best possible environment for them to make good choices. It's not to guarantee the outcome. Setting healthy boundaries is crucial for the sake of the relationship and for your own well-being. You can't pour from an empty cup.
So true.
And remember, this is almost always a long game. Success in medication adherence isn't usually an overnight victory. Think in terms of progress over months, even years, not days or weeks. Small, sustained improvements are what lead to better, lasting outcomes.
Patience and persistence. Okay, so after all this incredible guidance, let's talk about the payoff. What's the real profound benefit for you, the listener, and your loved one if you can implement these strategies?
The impact is immense. We mentioned adherence rates improving, but think about health outcomes. Strong family involvement in managing hypertension can actually reduce major cardiovascular events. Heart attack, stroke by up to 40%.
40% reduction, that's life-changing.
It absolutely is. You're doing so much more than helping with pills. You are, quite literally, helping to gift wrap extra years together for you and your loved one.
Gift wrapping extra years, I love that framing. And it's not just a statistic, is it? We heard about Mrs. Patterson's son.
Yeah, such a powerful story. His mother went from actively hiding her medications because she hated them to asking him for help organizing her weekly pill box. That's a huge shift.
Huge.
And more importantly, her blood pressure finally stabilized for the first time in 2 years. And her son said something really telling. He said, "She trusts me now, and I understand her better than I ever did before."
Wow, so the relationship itself got stronger.
Exactly.
Yeah.
That's the other payoff. These skills we've been talking about, better communication, emotional support, patience, empathy, they don't just help with medication, they enrich every aspect of your relationship. Many families find that navigating these health challenges together actually brings them closer, strengthening bonds.
That's beautiful. And it's okay to stumble along the way, right? To feel overwhelmed or lose your cool sometimes.
Oh, absolutely. It's completely normal. This is hard stuff. What matters isn't perfection. It's getting back up, trying again, and doing it with compassion, both for your loved one and, importantly, for yourself.
Definitely. And we absolutely have to include our crucial disclaimer here, always. Please, always consult with your doctor or your loved one's doctor before making any health decisions.
Yes. These strategies we've discussed are meant to complement professional medical care, never replace it. Your healthcare provider is your primary partner in figuring out the best medical plan.
Right. Use these tools alongside their guidance.
And think about the legacy here. When you navigate this challenge with compassion and effectiveness, you're not just helping one person. You're modeling healthy aging, family support, and resilience for everyone around you, maybe even for future generations. It's a legacy of care.
That's a really profound thought. So maybe a final thought for our listeners to mull over as we wrap up.
Yeah, here it is. The most powerful medicine isn't always found in a bottle. Sometimes the most powerful medicine is that patient, persistent, understanding love from a family that refuses to give up. You, the listener, you likely have far more influence over your loved one's health outcomes than you even realize. And now, hopefully, you feel like you have a much better toolkit to use that influence effectively and, just as importantly, lovingly.
It's a journey, for sure.
It is. But it's an opportunity for deeper connection, better health, and you really have got this. You can make a difference.